So you can come on down. We're going to room 242.
Interested in training the next generation of doctors? Becoming a volunteer patient with the UBC Southern Medical Program will give you that opportunity firsthand. There's no experience necessary, and this important role is both rewarding and a vital component to the MD undergrad program.
We treat live patients when we're physicians, so having the ability to interact with live patients I think is key for them to A, understand just how to interact with people and ultimately their future patients, and B, I don't think there's any substitute for actually learning on live patients in terms of dealing with variability in anatomy, dealing with different conditions, and then just learning how different hearts sound in different people. You get a soft murmur there, right?
Yeah.
Or how would you class that?
Can I listen again?
Yeah, I'm going to listen again. See.
You can read things over and over in a textbook, but actually, hearing that murmur or hearing those breath sounds is way different than ever actually, reading it in a textbook. And so for that aspect, it's wonderful. And on top of that, you actually get to interact with a patient, which the communication side itself is a whole other skill that needs to be developed. So it's very beneficial.
I think it's a critical part of education, transitioning from books to patients. And at first, it was a little bit nervous, but as more and more patients that we see, we become more comfortable, and it has definitely helped us get more comfortable with meeting patients, communicating with them, and performing clinical exams.
There will be a tutor, which is a physician, and the 4 students and the patient. And essentially, the tutor will normally run through the examination, so will explain how to do a cardiac examination on a patient, from inspecting to listening. And then they'll break that examination down, and the students will then have the opportunity to examine the patient, understand how their academic knowledge of that exam is applied to the patient, and then they can get feedback from the tutor as they work through how to learn to do that examination, for ultimately how to learn how to do it in patients to diagnose disease.
So we're just going to go into this room here. Sometimes we're looking for people with very specific conditions. So for example, this week we're doing respiratory exams. So we're bringing in patients who have pulmonary fibrosis or COPD or different types of respiratory conditions. And this is a 2-week session. So if somebody with one of these conditions is interested in being a volunteer patient, then they may come just once, or they could come up to 4 times, and then they don't have to come again for another year if they don't want to. There are other sessions where we bring in generally healthy volunteer patients, and that can be as many times as they're interested in participating. So it totally varies depending on the availability and their interest in participating. It's not an ongoing commitment.
This is a place where I feel comfortable volunteering because I'm interested in medicine. I was a biology teacher for 30 years, here for 25, and seeing students suddenly grasp a concept, it's really amazing.
I appreciate the fact that we're in a really comfortable environment where we get to practice our clinical skills, but at the same time there's guidance from our tutors, and we have the patient who's really patient with us, and it's an okay environment to make mistakes and do things over. If we don't hear something, then we can listen again. So it's a really stimulating and a good learning environment.
If you'd like more information on the program, just let us know.